On this episode of the Cancer Show, we are going to have an exciting conversation. Most of you, after the first video, DM me with a lot of messages. What are the causes of cancer? What can I do to prevent cancer? A whole lot. I know this video will settle that question of the causes of cancer. Now, disclaimer. As of now, there isn't an exact cause of a particular cancer. All that we do medically is to tell you the risk factors that will increase your chances of having certain cancers and how to prevent them. So now let's go into these risk factors. Generally, these risk factors will have their way of increasing your risk of certain cancers. So we put them together. Then you piece out the above, then you take it. If it resonates with you too, then you keep it. The first one is drinking and smoking. Combining these two increases your risk of breast cancer, colon cancer, throat cancer, cancer of your esophagus by at least more than even 3 times the normal rate. It means that if someone is a smoker who takes in tobacco, which contains about 7,000 carcinogens, these are things that can expose you to even having throat cancer, lung cancer, and other cancers, even breast cancer and ovarian cancer. Smoking alone will increase your chances of that. Other agents like cigarettes, which contains nicotine, also fuels cancer cells, so they will feed cancer cells. That's why smoking is very dangerous. Don't think that you are taking in vapes so you are also safe, because taking in these vapes, some contain formaldehyde, benzene, and other agents which are also highly carcinogenic. So please, as WHO has been making awareness on cancer, especially people who take in vapes, do not make yourself a scapegoat for that, because you are not far from it. Alcohol intake is one of the major risk factors when it comes to colon cancer, when it comes to breast cancer, when it comes to other cancers. Taking in alcohol will increase your risk for these cancers, and it has been proven. So please, if you are someone who consumes a lot of alcohol, please be mindful. Your liver too is at risk when it comes to alcohol. So you do not want to put yourself in that state. Kindly play safe and make sure that you look out there. There are other risk factors for other cancers, which includes certain infections. When it comes to cervical cancer in women, we have the HPV virus. This virus will disrupt your cervix and make sure that your risk of having cervical cancer is increased. We will go into cervical cancer in our next class. So please make sure, if you're a woman, you take in your pap smear and also check out so that you do not get certain infections. Certain infections like hepatitis B, hepatitis C, hepatitis E, all these viruses will increase your risk of liver cancer. And now, people who take in agents which are highly nephrotoxic. Now, if you say nephrotoxic, it means agents that are harmful to your kidney will expose you to kidney cancers. And the costs of these cancers are very enormous and very huge, and you do not want to make yourself a scapegoat in that. One essential thing that we all have to know: genetics play a critical role when it comes to cancer. Now, when you have certain genetic traits or certain genetic mutations which have been passed on from either your mother, your father, or both, then your chances of certain cancers are increased. An example is what we know as the BRCA1 and BRCA2 gene mutation. If you're a woman and you inherit the BRCA1 and BRCA2 gene mutation from your mother, it means your risk of having breast cancer is increased by 70% already. So now, if you are there and you think that yes, your mom maybe had breast cancer, it will be ideal for you to go and check whether you have these BRCA1, BRCA2 gene mutations out there. There are labs that will do this for you. If you have a familiar history of breast cancer or other cancers, then it means your risk of having that cancer is also increased. So please, let's be watchful out there and take our family history, especially when it comes to health, very, very serious, so that we know when to visit your doctor and also when to be careful when doing certain things. And there are certain lifestyles that also will increase your risk of certain cancers. The consumption of red meat now has been proven to increase your risk of having colon cancer. So we have a lot of colon cancer or cancer of your large intestine and colorectal cancer. This has been proven with the consumption of red meat and other form of meat. So if you are someone who consumes this kind of meat, then you have to advise yourself, when you get to a point, you have to pause and also change your diet. That's why you also need a very good dietitian that will help you on the way. Chemicals and other agents can also predispose you to cancer. Now, there are people who work in certain environments that comes with high radiations and also chemicals which are carcinogenic. If you are such an individual, you need routine check, and also you need to take yourself out of that space so that you don't have a continuous exposure to these things. So all these things sum together will increase your risk of various cancers. Sedentary lifestyle or a lifestyle without exercise will also increase your risk of having cancers and even other diseases, because these activities will just make sure that you do not exercise, your immune system is low, then your body is in a very dormant state, which will end up making you gain weight, and weight also plays a role when it comes to a whole lot of health conditions. So please, let's take it safe out there. Let's keep our health our topmost priority. There are more risk factors of cancer, but these are the common ones that will increase your risk for almost all the cancers out there. Cancer is real. I'll see you in the next class on The Cancer Show.